Hello, everyone. Good afternoon from the Philippines. I am Caroline, and I will be your host for today's event. Last May 2020, the first Asia Unmasked report shed light to the grim realities brought by the pandemic to Asia's most vulnerable children. The key findings of the Rapid Recovery Assessment conducted in 13 countries across Asia Pacific enabled World Vision area programs to better meet the needs of our most important stakeholder, the children, and amplify their voices in a broader regional and global arena. More than a year after, we coordinated a research effort for unmasking two childhood loss with most of the communities we partnered last year to see what has changed for who. And today we will be sharing with you the results of that initiative. As we start, feel free to introduce yourself to your fellow participants by writing your first name, again, just your first name, organization, and country in the chat. And while you do that, a very quick reminder as we have children and young people participating with us today for child safeguarding, please do not share personal information such as your contact details and address in the chat. Young leaders, if at some point you feel uncomfortable, please inform your adult mentor or send a direct message to the panelists and we will assist you. Thank you so much. I hope that is clear. Now let's meet some of our participants. I'm seeing AJ from UNICEF in India. Hi, good afternoon. I'm also seeing here Princess Beulah from Hand in Hand India. And namaste to all, says Mandira from Nepal. Okay, hi everyone. Just keep um, writing your name down here in our chat and introducing yourself so that the other participants would also get to know you. Again, just a reminder, your first name, organization, and country will do. Now, if you have questions later during our discussion, feel free to also type them in our chat box and we will do our best to address them later. Thank you so much. And again, welcome to this session. Now, before we proceed further, I'd like to call on Cherry and Thomas, World Vision Regional Leader for South Asia and Pacific, to welcome you to the session.
Thank you, Veronica. Good morning, good afternoon, good evening to all those attending this webinar. I see we have participation from various time zones across the world. We are indeed thankful to all our partners who are with us today, from the Joining Forces Coalition, UNICEF, the South Asia Coordinating Group, and many others. A special note of welcome to our host from World Vision Philippines, Carolyn Veronila, our young leader, Blessing Tu from Myanmar, and Roland Angara, representing the Joining Forces Coalition. This webinar is being held to launch our second report titled Unmasking 2, Childhood Lost, prepared by the Asia Pacific Office of World Vision on the impact of COVID on countries in the two regions, South Asia Pacific and East Asia. As many of you would be aware, the first report in this series, Asia Unmasked, was prepared last year, and it emphasized the grim realities in the wake of the COVID-19 pandemic being faced by Asia's most vulnerable children and their communities. Given the unprecedented situation that we faced the last year and continuing, which has not been witnessed for 100 years, we undertook rapid assessment surveys to figure out how we need to adjust our programming in the wake of this crisis. And what we have seen is that significant levels of income that have been reduced due to loss of or due to diminished livelihoods affected about 70% of the respondents last year. Food insecurity, heightened borrowings and use of savings and assets, loss of access to education and healthcare, and issues of child protection, physical and sexual abuse, child labor, early marriage, trafficking, all these were issues that we needed to contend with. So we were able to do that in bringing our programs focus increasingly to livelihoods and economic development, heightened child protection programming, cash and voucher programming, distribution of relief packages in places where there are acute crisis situations, and so on. We realized then that our research could have value not just for World Vision internally, but to partners and stakeholders, indeed, the entire global development community at large. And so we organized last year, in the month of August, a webinar under the umbrella of the Asia Pacific Learning Exchange that was created for this express purpose. Initially, we did this for South Asia and then used other fora for the larger Asia region, and more recently in the Pacific as well, where we shared what we have seen and what we have heard from our communities. Recognizing that levels of vulnerability and its very nature would shift due to the lingering nature of the pandemic, and with the second and third waves of varying intensity being seen across Asia over the last 6 months, we thought that an effort to review the continuing impact in many of these communities that we surveyed last year would be helpful. And it was good that we could again review the efficacy of our own programming and again join together with partners and stakeholders so that we could all take concerted efforts together on the issues that impact vulnerable children. This year, we have covered 9 countries in Asia, and the results continue to be heartbreaking, to say the least. Family incomes continue to be depressed, forcing children to economic activities, including child labor. Children continue to experience various vulnerabilities and forms of violence. Disruption in education continues with little or no access to learning opportunities. More of that, of course, when we share the findings. At a macro level, it's clear that the world has changed for the worse, especially for the most vulnerable people among us, but hopefully not irreversibly. Development gains made in the last 2 decades have been quite clearly reduced, and in some cases, development gains in the last 5 years have been more than fully wiped out. The World Bank recently estimated that over 120 million people worldwide would be pushed back into poverty. The bulk of them would be from the Asia Pacific region. Recent employment numbers in India reflect a significant drop in employment levels, both after the wave 1 and wave 2. While some of it has swung back to very to close to pre-COVID levels, the very nature of employment has changed. We see temporariness becoming more permanent. We see lesser protection for employees. We see the problems of underemployment and finally resulting in drop in levels of income for the poor. And ironically, this is happening at a time when the world's billionaires have seen their wealth grow by over a quarter, in some cases by over 35%, thanks to booming stock markets. So in the face of burgeoning inequality and distress, it is indeed most important that we use these occasions to analyze and discuss concert, combat and reverse the trend with action that meets both the tactical and strategic needs of the most vulnerable children and communities. It is my hope that our discussions today would contribute very meaningfully to this process. Once again, a very warm welcome to all of you. And I hope that all of us would be challenged and stimulated by these discussions. Thank you very much for joining us and a welcome once again. Thank you.
Thank you so much for your message, Chirian. Truly, we all look forward to what we're going to be able to discuss today so that we would know how we can fill in the gaps during this time. Now, we are going to proceed with the key highlights of the second unmasking report rather. And let us welcome World Vision Senior Director of Operations, Sarah Bayrup, to discuss that.
Thank you, Caroline. Thank you, Sherry, and I hope you can hear me okay. It is my pleasure to share the headline findings with you today. We welcome your questions. In the chat would be, I think, the most appropriate thing. Once we walk through the presentation, there may be opportunities to respond. Thank you, everyone. And as Sharon has so aptly put, we all know the pandemic has exacerbated social inequalities, existing vulnerabilities. It's certainly been an unprecedented period of trying to overcome COVID restrictions, restrictions to travel, and many other challenges. Let's move on to the second slide, please. Thank you. So just a brief note on our study approach. You'll see the research question at the top there. We've been really, the primary focus has been assessing the vulnerability of people World Vision works with and how this has changed over the last year. Our key thematic focus areas were on livelihoods, education, child protection, and mental health. And I'll touch on those in a moment. The number of respondents, we surveyed more than 11,000, nearly 12,000 individuals. 46% of these were children, 54% adults, and you'll see there was a fair balance there between male and female respondents, 40% male and 60% female. The study targeted 9 countries across the Asia Pacific region. And just to highlight there, you'll see the percentage in the pie chart in terms of, household and child surveys. So the 9 countries that were included: Thailand, Myanmar, Nepal, Cambodia, Sri Lanka, Laos, India, Vietnam, and Indonesia. Next slide, please. Always worth noting the limitations. Whilst we feel this has been an important research study, we're always very cognizant of the challenges in terms of implementing robust research. It's been a particularly challenging time to do that, and I'm sure many of our partners are facing the same sorts of challenges in terms of your rapid assessments. Just to note, remote surveys, of course, have been critical, but also quite challenging. A strict probability sample survey was not possible due to resource constraints. You'll also see that most of the samples were taken from World Vision's operational areas. We also found that the survey tools were not an exact repetition from the first study, partly due to the fact that we were improving our methodology in the second Unmasking report. Also just worth noting, of course, that the findings are really limited to perceived experiences, both for household and children respondents. We also noted that survey respondents were largely from the same communities and often the same households as the first study. I think most importantly, as you're all aware, we've seen rapid change even since the collection of this data. We've seen subsequent waves of COVID-19 and dramatic impacts, both primary and secondary impacts of COVID. Next slide, please. I'm going to touch on livelihoods now. You'll see a couple of key findings here. We'd be happy to circulate the report to anyone who hasn't seen it yet, but I'm just going to touch on those headline findings. Important to note that 63% of households reported a decrease in income in the second year of the pandemic. And this also led to a 35% reduction in spending on food, which we all know then has a multiplying effect, a multiplying negative impact. A couple of points I do want to highlight here too. There was a sharp increase in households experiencing poverty. We found this particularly high in Cambodia, Myanmar, and also Nepal. The other element I want to highlight here is that all countries actually saw a reduction in weekly income. There was no country that stood out in that regard. Nepal experiencing the greatest proportionate increase in households who have no income. And coping mechanisms, we continue to see in the second Unmasking report that many people are relying on borrowing from neighbours, relatives, friends, and they're spending whatever savings they have. So important, I think, to note that we're only seeing the tip of the iceberg in terms of the impacts of declines in livelihoods, something we will continue to assess, I'm sure. Education is the second thematic theme. Thank you for the next slide. We found that 1 in every 5 children were not attending school in any form. This is really concerning. 2 in every 3 children reported schools closing. And in Nepal, Cambodia, and Vietnam, we found the highest rates of no access to schools. And 55% of children without access to school could not actually access any digital or remote learning opportunities. That's really significant. Whilst online education is the preferred remote learning modality, only 20% actually have access to this type of remote learning. And only 40% have access to internet. So just before we go to the next slide, I just want to note, we've all seen this, but really the pandemic has also highlighted the digital divide. Really significant lack of digital literacy. So whilst many governments have made efforts to provide alternative types of learning, vulnerable children have most often not had access to that opportunity. Next slide, please. Thank you. I think mental health is one of the most concerning headline findings for us. We'll continue to take a really close, deep look at this. We've found that children have experienced adverse mental health, and we continue to see this rising. Children with pre-existing vulnerabilities are, of course, hardest hit, really finding this the most difficult time. You'll note just below, I do want to mention that for World Vision, we define vulnerability around 4 key categories, and that's really around extreme deprivation, catastrophe, disaster, abusive relationships, and serious discrimination. So let's take a look at these realities. Around 1 in 7 children felt so afraid that nothing could calm them down, most or all of the time in the last few weeks. And among highly vulnerable children, this actually increased to 1 in every 5 children, 20%. More than 1 in 9 children felt so angry they felt out of control. And amongst most vulnerable children, this again increased to 1 in every 6 children. I'll keep moving, please. Next slide. Child protection. Now, this is quite a dense slide. We would love to go a bit deeper on this with our partners and really welcome you all on this journey with us. I'll touch here on early marriage, child labour, as well as violence against children. There's a great deal to assess. What we found most concerning, sorry, if you can go back a slide, please. Thank you. The most concerning finding for us was really around the number of children who are now working due to loss of income and decreasing livelihoods. And that then exposes them to occupational hazards in turn. We're also very concerned about an increase in child labour. We've used the UNICEF definition of child labour for this research report. We found that 10% of children are engaged in child labour, and 1 in every 14 children who are engaged in labour are exposed to hazards. We also found, particularly around marriage, we'll keep monitoring this closely, but we found that 50 children under the age of 18 were reported married. 41 of these reported being married. This took place after the beginning of the pandemic. The last one just to highlight there is around 10% reported experiencing physical violence, and 1 in every 9 children reported experiencing emotional violence. Just want to note here that I think we've all heard the term shadow pandemic, that really describes the increase in family violence and gender-based violence. Something very important, of course, to be watching for. Next slide, please. There's a number of recommendations. We've honed in on 3 key target groups: governments, donors, and civil society. If you could just go to the next slide, please. Thank you. So we're really calling on governments to prioritise mental health and trauma recovery efforts. We're certainly asking for an increase in cash transfer schemes. We see huge impact of those schemes and the value of that programming. We also call on child-centred services to be prioritised. We've asked also that core child protection services be considered essential. They're not a luxury or an add-on extra. And this, of course, needs to be integrated with other sectors. The last recommendation to governments there is that we work alongside communities and civil society. We work towards reopening schools in a safe, inclusive and equitable manner. Next slide, please. Thank you. We're also calling on donors to be increasing funds to mental health and psychosocial support, with a particular focus on children and young people. As I said earlier, we've really only seen the tip of the iceberg, and there are huge concerns for the well-being of youth and children. We're calling on donors to also promote and fund cash assistance with a priority on green recovery. We're also calling on prioritisation for protection funding and the prevention and response to gender-based violence. We'd love to see collaboration, greater collaboration between governments and civil societies, and also just to be designing those action plans, funding those action plans that are very inclusive of communities and children. Next slide, please. To civil society, we want to stand in solidarity with you all as our partners and focus on raising awareness to change attitudes, reducing stigma and discrimination around mental health. We see huge value in implementing unconditional cash and voucher assistance programs, enabling parents and caregivers to manage their own mental health, therefore prioritising the mental health of their children also. And of course, that safe reopening of schools is such an important area for us to be working on together as civil society. Next slide, please. I really want to just touch on, I know Sherian has aptly talked about the way World Vision is responding, and just really from the get-go, from very early in the pandemic, our country programs across the Asia Pacific in 17 countries have developed action plans. We've certainly stepped up in terms of specific interventions dealing with protection issues. Of course, we'll continue to be rolling out hygiene education and PPE distribution. But I think really the agile programming that we can do, in line with COVID assessments is most important. And we look forward to really leveraging and mobilising more local partnership. We also continue to work with faith leaders and community leaders, including through vaccination promotion, reducing hesitancy across the region. I think the last slide is coming now, and maybe I'll just close before handing over back to Caroline. I think it's very important to highlight what we don't have on the slides here is just the importance of prioritising staff well-being and the well-being of our entire teams. We've found that whilst we've done the Unmasking 2 report, we also know the importance of making sure that our teams are caring for self, able to monitor things, able to work with agility, and that they have all the support they can get. I think I can finish there, Caroline, but thank you for the opportunity to present today, and thank you to all our partners present. We stand in solidarity with you.
Thank you so much for sharing the highlights of the second Unmasking report, Sarah. We have definitely learned a lot in terms of the gaps that we still need to meet, and at the same time how this pandemic has affected really the livelihood, education, and health of children and families. And thank you as well for your recommendations on what governments and CSOs can do. We're now seeing questions from our participants in the chat, and Philip, our research advisor, is answering some of them. So keep the questions coming, and we're very grateful to be able to answer that for you. Again, if you have questions, feel free to put them in our chat box, and we'll answer a few later. Now, let us hear the testimony of 17-year-old Blessing from Myanmar. This video was shown at the 48th regular session of the United Nations Human Rights Council.
Dear Miss President Mingalaba, greetings from Myanmar. I am Blessing, representing children from Myanmar. COVID-19 pandemic is the most significant global crisis in 75 years. Our schools are closed for 2 years and now we are delayed in education. Some children in urban areas could access to online classes, but children like myself in rural areas have very less chance to do so. Children spending more time makes them at risk of abuse and bullying. Children are missing out on routine immunization. My parents haven't got COVID-19 vaccine yet, same as many. Government hospitals do not function well. Private hospitals are expensive. That's a challenge when we get sick. Families become more poor and children have to go out and work on after to support their family income. World Vision did an segment on the impact of COVID-19 in the Asia and Pacific. It has found that children are experiencing adverse mental health as a result of COVID-19. One in every 5 children not attending school in any form, 55% of children affected by school closure are not able to continue accessing formal education remotely. 1 in 11 boys and girls have been sent to work for the family as a result of decreased family income. Ms. President, children recommend to urge governments to prioritize the mental health and trauma recovery of children and young people. Prioritize a plan of action to bring children back to school either in person or remotely now. Assistance continue to be provided with enough resource and that budgets will not be diverted to other purpose. Thank you very much.
Thank you for sharing your story, Blessing, and for giving us a glimpse of what you and your fellow children in Myanmar are experiencing. At this point, to give the keynote message in response to the Unmasking report, I'd like to call on Child Fund International Regional Director for Asia and the Chair of Joining Forces Asia, Roland Angerer. Joining Forces is a global consortium of 6 child focused non governmental organizations, namely World Vision, Child Fund International, Plan International, Terre des Hommes, Save the Children, and SOS Children's Villages. Roland, the floor is yours.
Okay, thank you very much, and hope you can put my slides on whilst I'm speaking. You gave me a tough assignment to speak after such a comprehensive presentation from Sarah and such an eloquent contribution from Blessing from Myanmar. Thank you very much for that. And let me start with a short introduction to what is joining forces. Caroline already gave you, can you go to the next slide, please? Caroline already gave you the membership. There are 6 international NGOs who have come together in 2017 and said, okay, it's actually time that we work together and we bring to bear all the power and all the resources we can muster to promote children's rights around the world. Those are really the 6 largest ones. And I think if we talk in a joint and common voice, we can really have an impact. And if you go to the next slide, please. Joining Forces has, over the last few years, developed 2 working streams, which are all centrally committed to children's voices. One is an advocacy stream. So in 2019, Studies were done in more than 20 countries, and they were launched together in a report for the 30th anniversary of the Convention of the Rights of the Child. That with the intention to put children's rights back onto the global agenda. And in parallel, in about 20 plus countries joining forces, all the agencies came together at country level to start joint programming and advocacy initiatives around the topic of ending violence against children. That is up and running. And if you go to the next slide, please, I can show you in Asia, there are 6 countries currently which have that platform up and running. Bangladesh, Cambodia, India, Indonesia, Philippines, and Nepal. And you can see the list of other countries in the 3 other continents where joining forces has started these initiatives. There are more countries in the pipeline. They're working on coming together, develop a format, how to collaborate. And as they emerge and as they contribute, joining forces will include them into the list. Joining forces, next slide, please, has also reacted to the COVID crisis naturally. And as joining forces as an alliance or initiative globally, a policy brief was published to talk about the situation of children during COVID. And individual members of joining forces, of course, have done their research and their studies. I've referenced one here on the slide. Save the Children and Plan International actually together published a report about the situation of girls and the impact of COVID on girls in Asia, because we matter is the title. And then we have also a number of reports coming from UN agencies. The latest one I could dig out was from UNESCO and UNICEF about the situation of education in the aftermath or during the COVID pandemic. So what I'm trying to do now is to give some keynotes to the report from World Vision. I thought to do a little bit of a comparison at probably a superficial level, of course, but show you what those other reports were all about. And if you go to the next slide, please, I've just listed the key topics which are very much congruent. You can find in what other agencies are doing, they're focusing on similar topics all around children's rights. You can see health and access to medical services. Of course, in the when COVID started, health was very much on the mind of everyone. Now it is coming back a little bit in the discussion around vaccination. Livelihoods and food security, major concern, as Sarah has clearly shown in her statistics and data and the feedback from the households. Education and learning, of course, is a topic which is important throughout, also from institutional responders. Governments are very much concerned about that topic. Protection from violence and abuse, a topic I'll come back to a little bit later. And children's voices and participation, which is a key factor for joining forces, as I said in the beginning. Let me point out 2 elements where I think the World Vision study really makes a difference and adds considerable value to what the others have been doing. One is the methodology. Going down to the household level and producing survey results from a large universe of communities and families who really live amongst the excluded population is something that's hard to come by from other studies. In other reports, you might find a lot of secondary data and information, but that first, what's the word, coming across as a first responder to say what is really happening with us on the ground, that's something very valuable which you should build on and bring into the discussion. And the second topic I found, which is exceptional, is the focus on mental health. Also something which I find is very important. We can see that in our programmatic work and our interaction with children and families. Children are significantly affected, and we have to deal and treat the COVID emergency as we do any other emergency, be it an earthquake or a typhoon hitting. Children have physical and mental effects from that, and COVID is no different. So focusing on mental health and bringing that into the debate, I think, is a very valuable point you could make through that study. What does not come out so strongly like in others is the area of child protection, and in particular, violence against children. And if you go to the next slide, please, you can see just a few data points. I'm not going into details of what the other studies are saying, but from secondary data, we know that the violence has been increasing significantly. The calls on domestic violence to different helplines and support systems have increased between 20% and 150%, depending on the country. So there's throughout an increase of reporting violence at home. And that's something, that's a topic which in the household survey is difficult to bring out. If you ask people directly, well, how is the violence situation in your household, you will probably not get a very honest answer about it. And that's a tricky thing. I think Sarah was talking about this shadow pandemic of violence against children, which we're facing. This virus of violence is a tricky one because it doesn't really show easily. To bring people to talk about it, it's still taboo. We have a lot of problems, cultural problems, to understand that violence is not the best way to educate children. And therefore, in a household survey, probably will be hard to get to data. The other aspect I find interesting to complement here is the area of online safety. And if you go to the next slide, please. I've just referenced a few data points of digital risks. We all know COVID has pushed us, for good or for bad, into the digital space. We're responding, we are doing our programs, we communicate much more online and through digital means, which has definitely its advantages and has brought a lot of benefits in the work we do. But on the other side, we see that particularly children face problems and risks. Often they spend long time alone and without supervision in the internet. And what that may lead to, you can see on these data points here. In the US, for example, the National Center for Missing and Exploited Children reports that they saw a 106% increase globally on suspected child sexual exploitation cases. In India, we have reports of 95% rise in the traffic which is searching for child sexual abuse content. And in the Philippines, children themselves say, okay, 37% of them have been contacted by strangers via social media. 30% have received sexual materials, and only half of them have actually reported to their parents or to some adults that this has happened to them. So that's a concerning area which is often overlooked, and we should keep it on our priority list. Finally, let me talk a little bit about conclusions or recommendations. If you go to the next slide, please. I have also tried to combine a little bit the different studies and what they recommend around the key topics that I've mentioned in the beginning. And you may see, if you go to the next slide, please, that there is again a lot of congruence and overlap with what World Vision is proposing here in the Unmasking study. First thing that comes out is child protection systems need strengthening. And one of the areas that is referenced is say, let's see child protection as a life-saving intervention. When we talk about emergencies, we have a list of things which save lives. We know that: food, shelter, water, etc. But violence on protecting children should equally be put on that list, because it affects children so much that we can say it affects their life for the rest of their lives. So life-saving intervention, child protection. The systems which respond to the threats for children should also get more attention. And we definitely, as NGOs, we should advocate for narrowing the gap in child protection funding. We can see that again from the emergency response. It's always kind of really top, really at the bottom of the funding opportunities and possibilities. And also governments are not always prioritizing child protection and the child protection systems in their budgeting process. Reporting mechanisms need to be child-friendly and focused on survivors. And a particular request is coming from there, make it gender-based and including girls' rights. It's not always self-understood that girls and women are using regular systems, and they often need the space and the possibility to talk to specific people in a specific environment and context, to open up, to talk about their experience of violent behaviors and exposure. Next slide, please. When we talk about online safety, I think there are a few things we can do and should commit to. Number one is we need guidelines. How can we help young people and children to navigate the internet in a safe way so that they know what the risks are, know how to respond to them? I always compare it with what did we do or what do we do with children when they grow up and they have to learn to cross the street and being exposed to the risk of being hit by a car. They have to learn that. We have to take them by the hand. We have to show them where the safe crossings are. And the same we have to do with the internet and the surfing and the online world. We have to give them the guidelines, the tools, and the ways to maneuver it to their benefits and to reduce and minimize the risks they have. Equally, I think we need to talk more with the social media platform providers and other technology companies, because there must be ways and means to detect and block this illegal content, which is spreading around like wildfire, like a virus again, in the internet. And there should be means or better means than we have right now to protect children with technology solutions. And finally, help children also to have a digital presence and to have child helplines to have a digital presence and to enable easy to reach supporting mechanisms for children. That should be as simple as a phone call, to click on a few buttons and then know I'm connected with a helpline where I can report any suspicious message or approach that I've been exposed to. If you go to the next slide, please. Child participation is definitely a key area for INGOs to say we are the ones who can enhance children's participation when it comes to the decisions that affect their lives. And that's no different when it comes to COVID and in the aftermath. And that has to do also with the participation of children online. I was actually really pleased when I heard the first thing that Caroline said in the introduction to this meeting. We have children online, be aware of it, and here are some rules of behavior we expect you to follow to protect those children. I think that has to become a standard way of operating when we have children online, and we need to develop these methodologies and ways of working with them and for them. And finally, and the last point and the last slide, please, brings me back to the beginning. Advocacy is certainly a topic which we should see as a tool and a way we should do together. We should join forces to actually multiply the strength of what we are saying as NGOs and make sure that we are heard. And the stronger we are, the more we are, the better chances we get to be heard by the decision makers. And I have put two things here which I think we should and could advocate for together. One, and that came also clearly from Sarah's presentation of your findings, advocate for direct cash transfers. I think that has been institutionalized or has been piloted and tested now in the COVID situation, that governments have started to provide direct transfers to families who are affected. But as somebody said in the question and answer box, okay, those are one-off things. Can't we institutionalize that? And my suggestion here would be, as NGOs, we should put that on our agenda. We see it in Europe, for example, many countries have continuous systems how families are being supported financially through child money. So a monthly contribution from the government to every family with a child. No matter if you're a millionaire or if you're a construction worker or a cash till operator, you get a specific amount for your child, for education, for nutrition, for health situations, and that amount is continuously available. And I think we should push for having that in all the countries where we work. And the last point, also coming back to something I said before, child participation and enabling the dialogue between children and decision makers in the countries is also a key thing we have and should do together as joining forces and as INGOs, because we are best situated to bring those stakeholders together. We have the means, the ways, the knowledge, we have the access to both sides. What we need to create is the spaces and the opportunities to do so. And I sincerely hope that this launch and the report, the Unmasking report from World Vision, is such an opportunity to bring stakeholders together to discuss and to improve the lives of children in Asia. Thank you very much, and good luck to everybody.
Thank you so much for your insights and your commitment, Roland, and of course, the whole Joining Forces in Asia team. We share the same sentiments with you that it's really important to involve children in this discussion and really helping them be able to address their issues and concerns to those who are in authority. And now that we're halfway through our session, we have seen so many people asking questions, and we also have staff answering them. But now I guess we can answer two questions here in our Q&A. Allow me to just open it. So we have one from Lawrence. He asked how the early child marriages increased, especially when there is decrease in livelihood income due to COVID pandemic, and what are the factors contributing this? Again, he asked how does the early child marriage how the early child marriages increased, especially when there is decrease in livelihood income due to COVID pandemic, and what are the factors contributing this? Sarah, would you like to answer this one?
Yes, absolutely. Look, I think the most important thing here is they are very correlated. That sadly, as livelihoods decline, we see an increase in negative coping mechanisms, and it's very difficult for families just to cope. So there's often not a lot of negative intent. It is simply a survival tactic. And we often see issues where traditional cultural norms, traditional practices are part of that survival response. I hope that answers the question for now.
Thank you, Sarah. Is there anyone else from our panel who would like to add on to that? Okay, I'm not hearing.
Carolyn?
Yes.
Yeah, just to add to what Sarah has mentioned, in other countries, sending a child for marriage means one mouth that would be less to feed, and also sometimes it is seen as the family of the husband or the supposed to be husband could possibly provide more income for the family of the bride. So I think that's why, as Sarah has mentioned, it could be a survival mode for the family.
Thank you, Olivet, for your additional input. Let's move on to yes.
I could just answer the question directly. If it is we've not seen as many instances of child marriage as one would have expected. So the numbers from the survey are less, which probably means that at least in the areas where we are working as World Vision, our programs are making a difference. A bigger problem the report really throws up is the issue of children getting engaged in economic activities, and that is where a larger number is currently involved. And that is worrying because a lot of them are in hazardous, what is classified as child labor. So that is really the bigger problem. It's not that child marriage is not there. There are reports of it, but at least in our program areas from the survey, the numbers have been relatively much smaller. Thank you.
Thank you, Cherian. I would like to also again thank Sarah and Olivet for adding your inputs about that and how really the decrease in livelihood income affects as well the risk of children engaging in child marriages, and also with Cherian's additional input regarding that in World Vision communities, it's not much on child marriage, but on child labor and how these children are being tasked to do things that are for adults in order to sustain the family. And that's very real in our communities and also in other countries. Okay, we have another question here from Micah. The question is, was there any alignment found between the digital risks or online violence and the children's mental health and psychosocial needs or concerns? So was there an alignment found between the digital risks or online violence and the children's mental health and psychosocial concerns? Anyone from World Vision?
Can I answer that?
Yes, please go
I
ahead, Philip.
Actually, we tried to correlate the experiences of mental health and the digital exposures of children, but unfortunately, we did not identify. One is we have really minimal indicators in the assessment. The mental health was not really focused on during the assessments. That's why we really have minimal indicators, and maybe this will be focused in future engagements around this field. Thank you.
Thank you, Philip.
May
Okay.
I add to that as well? Because I think this is a very smart question. I haven't found anything, or I'm not aware of anything if that has been done somewhere in another study. But I think when we talk about mental health and talk to children, we often hear answers like, okay, I don't feel so well, I'm sad, I'm confused or something. It is really about asking, why is that the case? And it may well be that they have been exposed to something they don't want to talk about. And so we need to dig deeper. And that's usually what child protection mechanisms can do. And that's why it's so important to have children's voices in and at the same time respond adequately and find the reasons why they express negative feelings and sentiments. And the online risk and exposure can well be a reason for that.
Thank you, Roland, for adding your thoughts. As what Philip said, we can explore adding that to our research because, again, that's a very important aspect to look into. And I guess that's the only time that we have right now for the question and answer. You can still put in your questions in the chat, and our staff will be able, and our panelists would love to answer them for you. Now we are going to proceed. Thank you again for throwing in your questions. And we have heard now that now we have heard the messages and responses of our esteemed speakers, and we believe that it is equally important to listen to the statements of children.
Ayun.
Mingalaba.
Magandang araw.
สวัสดีค่ะ
Namaste.
Assalamualaikum warahmatullahi wabarakatuh. Hai.
Children in the Asia Pacific face some of the most serious vulnerabilities.
Almost 1 in 5 girls are married before the age of 15.
2 dari 5 anak stunting di dunia tinggal di Asia Selatan.
150 million children were unable to go to school even before COVID-19.
42% of all children suffer physical abuse.
We are here to talk to you about
our dream for every child in this region.
We want to see every child have access to education.
Every boy,
every girl.
Without education, we can dream bigger,
expand our horizons, or support others who will come after us.
COVID-19 telah membuat pendidikan semakin jauh dari kita dari sebelumnya.
We also need to be safe, no matter where we are learning.
Be it home, online, or school.
Child marriage,
child abuse,
anak-anak yang bekerja di pekerjaan berbahaya,
bullying,
violence. We want to see it all end.
Kami ingin mendesak penegakan aturan yang ketat terhadap masalah ini.
We raise our voice to say
no,
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 no, no,
no
to this.
For our voices to be stronger,
we need yours
to join ours.
Children should be in school,
not marry or at work.
That affects their development.
We want every child to be able
to protect themselves and one another from all forms of harm.
Setiap anak harus diberikan kesadaran, fasilitas, dan informasi yang cukup tentang perlindungan.
Every child should know where to go.
whom to talk to,
what legal services and psychological support are available for them.
Every community must ensure that the children are loved, respected, and that their dignity is upheld.
No child should be misused
For political
and social advantages
of other people.
Kami bukan komoditas.
We want to be healthy to reach our full potential.
for children to have nutritious food and nutrition garden should be promoted with every family.
Especially those struggle economically.
We want to see parents adopt sustainable income generating initiatives
so that they can provide better for their children and they can take care of the essential needs.
Children should be included in development work.
not just as receiver,
but also as contributors.
We should have space to express,
to be heard,
and taken seriously like in this forum.
We are ready to go further
for each other.
I am Dasit Anushka for the children of Asia.
I am Blessing Chu for the children of Asia.
I am Adornado B. Cabalbag Jr. for the children of Asia.
Saya Tahani untuk anak-anak Asia.
I am Bim Priksa for the children of Asia.
I am Shimandal for the children of Asia.
This is our
promise.
promise.
Will you
Will you
promise
promise the same?
What a wonderful video. Now, on behalf of vulnerable children, here to give her recommendations, let us welcome Youth Leader Blessing.
Hello everyone. Mingalaba, greetings from Myanmar. I am Blessing, young leader from Myanmar. I am proud to present my opinion on the recommendations related to the report which is launched today. COVID-19 pandemic is the most significant global crisis in 75 years. Since COVID-19 started, our schools are closed for 2 years now and we are delayed in education. Many children in rural areas have limited internet and in some areas there is no internet. So they could not access to online classes. Because of less physical meeting with friends, most children spend time online, which makes them to face risks of online abuse and bullying. Younger children are missing routine immunizations. Many adults, including my parents, still do not get COVID-19 vaccine yet. Government hospitals do not fully function and there are still not sufficient doctors and nurses in the hospitals. Private hospitals are available, but they are expensive. So many families tried to treat their sick children at home, which is very risky. Some parents lost their jobs and family become poor. Children have to go out and work an job to support their family income. Myself, now as an eldest daughter, I have concerned my family as my parents doesn't have regular income since COVID started. I am trying to help my family like helping in livestock breeding. One of my friends, her name is Titi, who lives in another village. Her mother lost her jobs due to COVID-19 and her father could not work due to chronic illness. Since the school is closed, she is now helping her family income by selling eggs and dry fish in her village. She also helps her mom to make simple dresses for children and women. It is only some of the experience that my friends and I are facing now. Actually, many youths are losing their income generation. In many cases, they are losing hopes. My recommendations that I would like to make to the government are I want to government hospitals to have enough medicines and equipment like oxygen plants. Also adequate, skillful, and kind doctors and nurses. There are also local volunteer groups in the communities and churches who help to sick people. It would be great if the government also work with them and support them so that sick people will receive treatment timely. Many people in the village want to volunteer, so if their organizations like World Vision and other organizations can work with them in raising awareness on health in their communities. As for the education, children in the communities have less chance to get online classes. So if the government education staff can train the communities volunteers in order to provide and support the children in their communities with school lessons. I want the government create internet accessibility for online learning, especially for high school and university students who live in rural areas. Children, especially like myself, are currently suffering with distress due to school closure and lack of physical activities. We want our parents and adults to understand our feelings and support us emotionally and spiritually. I would like to request the organization like World Vision to support the poor families with food to address immediate needs and provide income generation activities for business recovery. Thank you again for giving me opportunity to share the recommendations which represent children and young people. And I hope we will have better future in the near future. Thank you very much.
Thank you for sharing your recommendations, Blessing. And we're really grateful that you are here with us this afternoon, as well as other youth participants in this webinar. Now, to respond to that and to give a message of commitment, I'd like to call on Terry Ferrari, World Vision Regional Leader for East Asia.
Hello to all of you. I apologize. I'm not going to be able to put on my video today because my internet is not cooperating. Of today's session, and most of all to Blessing, her willingness to represent the thousands of children. Like many organizations, World Vision has adapted our programming to address the urgent challenges posed by COVID-19. To date, with the generous donations from individuals and institutions from around the world, we've reached almost 17 million people across Asia Pacific, including over 7 million children through our COVID-19 programs. We've partnered with communities to provide 4.8 million community members with materials to limit the spread of the virus. We've delivered 1.5 million individual hand washing kits and 1.8 million hygiene kits, and have constructed over 21,000 water systems and facilities. We've strengthened health systems by training over 20,000 community health workers, distributed over 5 million face masks to frontline workers, and we've supported and rehabilitated over 300 quarantine centers. World Vision has also provided basic necessities for vulnerable families. Our programs in child protection, education, and livelihoods and food security. We have distributed over $9 million worth of cash vouchers. Additionally, food, livelihood assets, and materials to support remote learning. With partners like you, we've contributed to influencing 91 global, regional, and national policies to improve the COVID-19 response to impact the most vulnerable children and families. And without a doubt, so much has been done to positively impact the well-being of children across the region from all of us. But we've learning from these findings of this report and from listening to children like Blessing that our work is far from being over. Between the first Unmasking report, which was released in May of 2020, to today's report, we've seen the situation for vulnerable children has actually gotten worse. Today, we've heard from Blessing And she represents the almost 500 other girls and boys from across the region. We know each of these children by name. We know their families, and we've journeyed with them for many years. They are our biggest partners in our development work. Blessing's recommendations for governments, caregivers, communities, and civil society are practical solutions for all of us, no matter who or what we represent. It will take all of us, governments, civil society, religious leaders, caregivers, community members, donor organizations, and financial institutions working together to coordinate our actions, to adapt whatever resources we have to recover from this incredible social, emotional, and educational loss from COVID-19, as well as the opportunity cost caused by the pandemic. COVID reminds us that all children's vulnerabilities get compounded in any adverse situation. Our survey revealed that on average, 4% of children surveyed felt so hopeless, they did not want to carry on living. But when you look at children engaged in economic activities, the number jumps to a staggering 77% of them who see no point in living. It's even more heartbreaking to hear the stories of anxiety and that children are experiencing fear. I was particularly struck by Blessing's remark that children and youth are suffering from emotional distress because of school closures and the lack of physical activities. Her request is simple for parents and adults: that we understand the difficulties, that we provide emotional and spiritual support. And her message resonates with me because I'm a mom myself. We have to recognize that it's only recently that the issue of mental health has gained prominence in public discourse. The same cannot be said of children's mental health, especially those of vulnerable children. Our report found that children and people carry the burden of mental health conditions, and it's unthinkable that most countries where we live and work have insufficient support services in place to respond to mental health issues. Our children deserve better. We can do better. It's a good sign to see the attention being given to the relationship between children's mental health and the future of life's outcomes. The recent State of the World's Children report, written by UNICEF, has a strong focus on children's mental health. But so much more needs to be done to fight against this stigma and to promote better understanding of issues of mental health. As organizations and governments constantly realign their socio-economic recovery plans based on an ever-changing landscape, we must pay urgent attention and action to prioritize children's mental health, learning, and protection needs. In just 2 years, COVID-19 has undone years of progress that we've all worked collectively to achieve. Children engaged in economic activities because of losses in family livelihood are losing more than their childhood. They're losing hope. The Unmasking 2 report showed that 63% of the household surveys said their income had decreased in the second year of the pandemic. And even worse, that led to a 35% reduction in food expenditure. According to UNICEF's recent report, more than 150 million more children may lack access to healthcare and education by the end of the year. If we want to get things back on track for these children and their families, and we want to undo some of the damage afflicted by COVID-19, we need to urge all relevant decision makers, those within our organization and outside of our organizations, power holders and duty bearers, to direct increased resource investments to development efforts. The Unmasking 2 report revealed that more than half of the children surveyed who were affected by school closures were not able to continue accessing formal education remotely. And now we know, only time will tell what the impact of the lack of access to school, to healthcare facilities, vaccinations, protection, and nutrition will be on the lives of children today. We cannot stand by and continue to let all of what is happening negatively impact our children's tomorrow. One of the main reasons we're having this conversation today is to share with you the results of our assessment. And more importantly, you may want to take this information and decide What is the appropriate action for you and your organization to take? World Vision is already implementing various interventions to address mental health gaps and psychosocial well-being of children and their families. We're testing and using evidence to scale up the utilization of multi-layered and multi-component interventions to address the mental health challenges for both children and adults in vulnerable, resource-starved settings. Some of you on this call may have already adapted your programs. I know our programs in Nepal and Cambodia and Laos have already shared their results at the national level with a very broad group of stakeholders so that they could start working together to address the needs of vulnerable communities. We urge you that if you are located in a country where World Vision works, to reach out to your local World Vision office to find out what they have learned from their study. Recognizing the serious mental health concerns, World Vision Cambodia has started to partner with mental health providers already in the community to ensure children and families get the support they need. We are serious about sustainable development and want to eradicate systemic inequity in our communities and our countries. We must provide immediate relief to vulnerable families and commit to stronger interagency collaboration to build on longer-term opportunities presented by the epidemic. There are many studies out there that Roland shared with us that are all discussing and sharing what's happening to children, about the economic losses that are suffering, that all of us are suffering from because of the pandemic. But I worry that the real price of this pandemic is going to be paid by children for generations to come. The evidence of how badly this crisis is affecting our own children and millions more vulnerable children today is merely an indicator of how much worse their tomorrow might be. We're in the middle of what is arguably the most significant global crisis to occur in our lifetime. But we also find ourselves in a position of power where we can influence change. I thank you for your time and your contribution to today's conversation. But let me end by saying that we must rally for all of our children. Let's today commit to no more childhoods being lost. Let's commit to restore hope, joy, and justice for all children. Thank you.
Thank you, Terry. Truly, it takes all of us working together to address the issues affecting vulnerable children today. And thank you for emphasizing that and recognizing the problems that we are facing. What we have to do is a good start. So we would also like to extend our gratitude to all our speakers, partners, child and youth leaders, supporters, and guests who are joining us today. By identifying the issues and gaps we need to address, it is our hope to empower children to provide recommendations on issues affecting them as highlighted in the report, and to communicate the recommendations to governments, civil society organizations, and other stakeholders for action. We are the voice of the voiceless, and we commit to do all these for the children we serve. That's the end of our program. Thank you again and enjoy the rest of your day.